All right, everybody, welcome to Advantage Medical Testing Training. This is going to be a refresher for some people, and this is also going to be considered to be new agent training as well. So let's talk about Advantage Medical Testing really quickly. We're a nationwide firm that does genetic testing for no cost and for direct-to-consumer or retail testing. And we're going to go over our mission and vision statement as well. So welcome, everybody. Here we go. Let's do a little bit of the overview of what we're going to be talking about today. Again, this is a refresher for some. This is new for some, but it's all good information to talk about it more than once. So here we go. We're going to talk about the company structure. We're going to talk about Medicare and Medicaid. We're going to take a little tour of the website, which, you know, what's constant here is change. And we're going to talk about qualifying patients, pre-qualifying them, some of the paperwork that's involved in performing these no-cost tests. We'll also dip into a little bit of the retail side. We're going to talk about how to collect the samples or specimens, we'd like to call swabbing, how to handle those specimens, get them to the lab. And we're going to talk about how to submit production reports, swab packing slips, and so that we can get paid for our stuff, for our work. Again, this is Christian Weiss. I'm the Managing Director for Advantage Medical Testing. Our corporate office is located in Colorado Springs, Colorado, and we're currently in a bunch of states, and we're constantly growing, and we're constantly moving forward to get in line with our vision and mission statement. Let's talk about this. Medicare. Medicare is an insurance that is pretty much paid for by the federal government for people aged 65 and older. When we refer to Medicare program at Advantage Medical Testing, we're referring to participants in the Medicare program that are ages 65 to 80 years old. We will be dealing with Medicare Part B. Medicare Part B is the doctor's visits. Medicare Part A is going to be catastrophic events. It's going to be hospital stays and that kind of a thing. Again, Medicare B is the doctor's visits and durables. Okay. Here's the way that the company is structured. We have a corporate office. This is not a multi-level marketing company. We have a corporate office, and we have a system of the corporate staff, regional managers, state or territory managers, and then genetic testing technicians. We do have some support that are not medical related jobs or testing related jobs. We have a brand ambassador. We also have administrative staff. And our tests that are performed using the Medicare, we call them no-cost tests because they're no cost to the person getting the test done to them. It's not free. Please remove the word free from your vocabulary. It's no cost to the patient, and the tests are paid for by Medicare. The way that our agents are compensated here for Medicare tests are on a flat rate basis by test. Another program that we work with in the no-cost category is the Medicaid program. Medicaid personnel or people are eligible for Medicaid based on their income that they have currently or other things in their life that may make them partially disabled to where they can't work full-time. And again, it's a flat rate compensation, and this company structure is the same. Medicaid is available in all states. Okay, we unfortunately can only perform these no-cost tests in a few states at this time. That list is constantly changing and growing. Sometimes it shrinks, sometimes it grows. Again, same structure. Corporate staff, regional managers, state and territory managers, technicians, support staff like admin and brand ambassador. Then we have the third part of our company, and that is the retail side. This is definitely not a no-cost program. Definitely not a no-cost program. This is direct-to-consumer sales. This is money changes hands to get the tests between the patients and the company. And the way this hierarchy works is genetic testing technicians and then the corporate office. That's kind of the chain of command there. Insurance-funded testing, this is referring to Medicare and Medicaid programs at this time. As of today, we're offering 4 Medicare no-cost tests and 5 Medicaid no-cost tests. The first test that we offer is the PGX test. That's going to be dealing with pharmaceuticals and the way they interact with our bodies. CGX test, that's our cancer screening test. Cardio test, cardiovascular system test. Alzheimer's, Parkinson's, and dementia test. And the Beacon Carrier test. So all 4 of the tests that were listed above are Medicare, and all 4 plus Beacon Carrier tests are for Medicaid. To pre-qualify for these programs, the patient has to have a Medicare Part B. You can get Medicare Part A and no Medicare Part B. Medicare Part A is on the house, so to speak, with the feds. Medicare Part B, there is a premium. And Medicare Part B also then opens up the customers to purchase Medicare supplement insurance to help with deductibles and copays. We, however, are going to be dealing with the Medicare Part B cardholders. And there'll be a PPO or an HMO. Let me go ahead and tell you what the PPOs are. We'll get into this a little deeper in a minute. PPO and HMO. HMO plans are where the government or the insurance company essentially tells you, you have the following choices for doctors and hospitals. It's a very limited list, typically divided by geography. So anything you do with your health care with an HMO has to be approved by the insurance company, pretty much pre-approved, and you can only see certain practitioners. If for some reason you have something where you need a specialty service, they'll have to give you a referral to go outside of that network. Very rare. PPO is out-of-network coverage. So that's why what we use to qualify people as a PPO, because our labs are out of their primary networks most times. We do use one HMO, and that's Humana. So our people, if they qualify and they have a Humana HMO, it'll usually work. Medicaid, like I said, is approved in certain states. And we won't be focusing on the Medicaid test today. The people that are in those Medicaid states will get individualized training. Goes without saying, but we say it anyway. We have a zero tolerance for Medicare or Medicaid fraud here. Zero tolerance. Medicare and Medicaid fraud is rampant in this industry right now. We do what we can to stay ahead of it. And the way that we stay ahead of it is by operating within the guidelines. Guidelines are constantly changing, and so we stay ahead of those changes. That's why you'll notice sometimes we have changes to our programs. Additional steps, perhaps. Just so you're aware, though, Medicare and Medicaid fraud is no joke. If you get caught doing it, go to jail. Again, we have a zero tolerance policy. HIPAA. All of you have a HIPAA certification, so we're not going to go into that very deeply. Just know this, that we're HIPAA compliant, and we need you to be HIPAA compliant. So I know a lot of us just kind of went through that training to get through it, but one thing you should have got out of there is that HIPAA compliance is key, okay? If you don't recall all the things in your HIPAA training, just remember this, patient privacy is number one. The Medicare program, here's a sample of a couple Medicare cards. The old one and the new one. Again, we deal with people on Medicare that are age 65 to 80, Part B holders, not 81. So somebody turns 80 in January, and November of that same year, they are still eligible for the no-cost test if they make the medical qualifications. Also, Medicare also has a disability program. So anyone over the age of 18 that has Medicare disability, again, PPO and HMO rules are the same. You can go ahead and send their tests in. Currently, The Medicaid states that we can do business in using the no-cost testing is going to be Colorado, Georgia, Louisiana, Maryland, and Tennessee. The next one on the list is Florida. That'll be coming up very soon. A couple key terms for you. Swabbing and quality control. We use these terms quite frequently, so let's talk about what they are. Swabbing is using a certified sterile device to collect a DNA sample from the client. We use a sterile buccal swab, which is a cheek swab. And one thing we need to make clear right away is that the patients are the ones swabbing themselves. We are not sticking our hands in their mouth or holding the testing device in their mouth. If there comes a situation where the patient can't move their arms or doesn't have a caretaker handy, you need to make a phone call to the corporate office before you do that, before you have to help them. Some more terms. Doctor. Kind of silly, right? When we say the patient's doctor, we're not always referring to their primary care physician. We're referring to one of our doctors that is licensed and board certified in the states that the patient resides in. Okay? So the doctor is the physician, whether it be their primary or another doctor, that will review our applications and determine if there is a medical necessity to order these tests. All of our no-cost tests are based on medical necessity. Our direct-to-consumer tests or retail panels are not based on medical necessity, are not overseen by a doctor or an insurance company, so therefore there does not need to be a medical necessity for our retail program. There is, though, however, for our no-cost program. The PGX test, the CGX test, the cardio, and the APD test, and then the Beacon Carrier need to have a medical necessity before the doctors will approve these tests. To make it clear, as technicians, you are not administering a test. You are simply pre-qualifying the patient and collecting a specimen and sending it in. You are not conducting the test. The test does not get conducted until the specimens arrive at the lab, which occurs after the doctor has ordered the test. QC in the lab. These are third parties that we use to help us out with the applications, make sure that they are compliant with all federal, local, and state laws. And they also assist us in getting doctors to look at these applications, whether it be the primary care physician or another doctor, to get the test approvals. Again, I got to repeat this. You are not doing the test when you are collecting a specimen. There's some confusion there. We'll talk about that in a bit. Ascension, that is when the laboratory receives the specimen and makes sure that there's enough viable DNA to run the test on. Ascension. All right, so let's get into the tests that we offer. We talked about PGX. What is PGX? Well, PGX is a short abbreviation for the word pharmacogenomics. And it's a study of how genes affect a person's response to drugs. This is an important test. Medical and prescription error are the third leading cause of death in America after heart disease and cancer. That is why this test, if they medically qualify, is very important. So it's a science of a study of genes and their functions and the development to help develop safe and effective medications, and also, just as important, is dosages to make sure that the patient is getting the benefit out of that pharmaceutical. And so basically we run a test to determine or predict a patient's likelihood to experience an adverse reaction to medications. Some patients are on many prescriptions and are seeing several doctors, and this is to help them manage their medications. The CGX test, it's our cancer genomics test. It's a screening test. It does not tell you whether or not you have cancer, but it in fact tells you what your likelihood is to receive hereditary cancer or to pass on the gene mutations that could also make your downline, so to speak, susceptible to hereditary cancer. So The hereditary screening is for just that, hereditary cancers. It does not screen for environmental cancers such as lung cancer, which is avoidable by your environment, lymphoma, and skin cancer. There's an exception to the skin cancer rule. We'll talk about that in a minute. But it's to discover any markers, okay, for the predilection of cancer in the human body. There's different types of cancer screenings that are performed when we run the CGX test. So essentially, this is not a test to see if you have cancer, but it's a test to see if you're at risk for getting it. Our cardio test, cardiovascular test, again, it's not a screening to tell you if you have heart conditions. What it is a screening for the likelihood of getting inherited heart diseases and passing them down. APD, that stands for Alzheimer's, Parkinson's, and dementia. Again, does not screen to let you know if you have these things. It lets you know the likelihood that you'll receive Alzheimer's, Parkinson's, or dementia from your family members above you and passing them down to your family members after you. The Beacon Carrier test. This is a Medicaid-only test, but it's a screening for inherited disease likelihood for the following: cystic fibrosis, Fragile X, sickle cell anemia, spinal muscular atrophy, Tay-Sachs, thalassemia, Canavan disease, Bloom syndrome, and Wilson disease. There's a few more, too, that didn't make the list that they also screened for. But this is a test for a female, age 18 to 35, that is either A, had a child, B, is currently pregnant with a child, or C, is likely to get pregnant in her future. This test, by the way, is sometimes performed during the pregnancy automatically at certain hospitals. Two big terms that we're going to use frequently: personal history and family history. These tests require personal or family histories to qualify medically, and the amounts of family members vary by test. So let's talk about personal history. That's exactly what it is. The person that you're sitting in front of has a personal history of the condition. Okay? Family history. At family history, what we refer to is first, second, and third degree blood relatives. So if someone is adopted and they do not know the answers to the questions on the applications, if they're not familiar with their family history, they will not medically qualify. However, if they are adopted and they do have information about their birth parents, they still may qualify for some of these tests. Let's talk about first degree. That is your parent or child or sibling. Okay? Mom, dad, son, daughter, brother, sister. Second degree would be grandparent, grandchild, aunt, uncle, niece, nephew, and a half-sibling. Third degree, great-grandparent, great-grandchild, great-uncle, great-aunt, or a cousin. Third degree can be a cousin. So we look at three different generations here, okay? So being that someone on Medicare, unless they're on disability, is age 65 to 80, when you're dealing with them, they may not have a vested interest in their own susceptibility to receive a hereditary condition, but it's important to understand for them that they are able then to pass on these mutations, which can cause problems in their downline, I call it. Kids and grandkids and great-grandkids. So even if the person doesn't really care about their own health, more than likely they'll care about the health of the people that are coming after them. So we're going to talk about how to qualify a patient. Difficult conversation when you're running into people sometimes. But if you're at an event, you're in a one-on-one, or what have you, there's a tactful way to ask these questions. The conversation that you start with somebody when you're trying to get them interested in what we offer here, do not start the conversation immediately off and saying, hey, do you have a personal or family history of cancer? It's rude, number one. So more than likely what you do is you'll talk to someone and say, hey, listen, and when the conversation gets to what do? Well, I work with Advantage Medical Testing. We do DNA testing. And they may say, well, yeah, what's that all about? Is that like 123andMe or 23andMe or whatever? No. What we're not is we're not a genealogy DNA testing facility. This is not about your relatives, where they come from. This is about health screenings. So you can make that clarification, make that difference known. The conversation will start to flow smoothly. So what we're doing is we're trying to help you guys understand your benefits with your insurance. And we're out here offering a no-cost test to you if you qualify medically. Would you be interested to learn more? If they say, yeah, then you start your engagement. If they say no, then be prepared to hand them a brochure and say, well, listen, if you change your mind, give us a call, or hey, feel free to go talk to your doctor and see if he thinks this is a good idea. So right now, let's talk about how to qualify for the PGX test. Again, the pharmacogenomic testing. The patient must be prescribed medicines, period. Okay, they have to have a prescription, and they have to have a prescription for at least 2 medicines that are, picked up at the pharmacy. And there's 3 categories that we look at here for qualifying prescriptions. They have to be, again, at least 2, and they have to be for one of the following. It can be mix and match. They can be on a blood or heart pill, cholesterol pill. Okay, that's going to be in the blood and heart category, high blood pressure and such. The second category is pain management. It has to be a long-term pain. It has to be a chronic pain. It cannot be they broke their arm and now they're getting some codeine for the pain there. It has to be a chronic pain situation. Or something that's psychological, like Xanax, Seroquel, Adderall. Something for anxiety, ADHD, something, depression. Okay, they have to be on a psychological pill. Now, you'll notice these 3 categories pretty much cover most of the prescriptions out there. And I say you have to be on at least 2, but when somebody starts listing their medications to you, you're going to write them all down because you're trying to build a case for medical necessity. Medical necessity is the key word here. So if they're on 2, they might be on 3. Don't just stop. At 2, keep going. Dig deeper. Get all of the medications. Even if they say they're on an aspirin pill prescribed by their doctor, add that. Okay? If the doctor says I'm prescribing you vitamin C, well, if it's a prescription, it goes on the list. How to qualify for the cancer genomic test or the CGX test? Again, we need a personal history of a non-environmental cancer. Again, lung disease does not count. Skin disease does not count. Lymphoma does not count. Leukemia does not count. Believe it or not, these are all considered to be environmental cancers. The one exception for a cancer qualifier is going to be melanoma. Remember that term, melanoma. If they have a personal history of a melanoma, they will qualify for this test. Or, if we don't have a personal family history, we need to have, a personal history of cancer, we need a family history of cancer. And we need 3 family members can be on either side of the family tree, but they have to be blood relatives, having a non-gender specific and non-environmental cancer. If they have 7, you write down 7. If they got 4, you write down 4. You don't stop at 2, you don't stop at 3. Now, gender-only cancers, we'll talk about that in a second and how they kind of work. Cannot have an opposite gender-only cancer. For example, if you're in front of a male and he says, I have an aunt with ovarian cancer, and that's the only family history, that won't work. Same thing with the female. If they say, yeah, I have an uncle that has prostate cancer, that will not work as a qualifier. However, if you find 2 family members that have a non-environmental cancer and that third person does have a gender opposite specific cancer, that will be considered and may or may not get approved. It depends on the doctor. So therefore, opposite specific cancers, you can use them as one of your three, but the other two better be non-environmental and non-gender opposite only. Breast cancer is not a gender opposite only condition. Here's a few cancers that will qualify, and there's more. Breast cancer, ovarian cancer, colorectal cancer, pancreatic cancer, prostate cancer. There's many more. Here's some more that help build the case. Bladder, testicular, spleen, liver, fallopian tube, melanoma, thyroid, brain, kidney, and stomach. Cancers that don't qualify. Those environmentals, lung cancer, leukemia, skin cancer, unless it's a melanoma. The reason being is that lung cancer is an environmental cancer, and that can be avoided. I mean, you may not have the choice of whether or not you get lung cancer because of your occupation or whatever. However, it's still avoidable. It doesn't mean that it was in your control. It just means it was avoidable. It could have been avoided. Here's the cardio qualifications. Okay? A personal history of 2 conditions. That could be a blood pressure pill and a cholesterol pill will qualify that person for the cardio test. If there's no personal history, then we have to look at 2 family members with conditions. And those conditions are, again, blood and heart, so cholesterol, high blood pressure. Now, with the family member qualifying conditions, they can be deceased family members. They can be. But as for all of our tests, the family members can be deceased. But we still need some further information about that. We'll talk about that in a second as well. APD qualifications, Alzheimer's, Parkinson's, and dementia. We do not need to have a personal history here. As a matter of fact, if they have a personal history of anything other than Parkinson's, they will not qualify for our program. So we look primarily at the family members. So at least 2 members in their bloodline have to have Alzheimer's, Parkinson's, or dementia. And again, they can be deceased. This is the only test where we require not just aunt, uncle, brother, sister relationships. We actually require first and last name, try to get their date of birth, and when they were diagnosed. All of our family history questions on all the other tests ask for the relationship and age of diagnosis. So if you do not have that in front of you, you can pause and have your patient make a phone call, do what they have to do, or reschedule until you can get that information. Beacon carrier screening, Medicaid only. Qualifications are a female has to be 18 to 35 years old, okay, who either are pregnant, were pregnant, or can get pregnant. This is the catch on the Beacon carrier test. In order for that 18 to 35-year-old female to qualify medically for this test, they have to answer yes to a question. Are you planning on getting pregnant? Okay? So if they say, well, no, I'm not going to have any more kids, then they don't qualify. Okay? So if they say, well, I'm thinking about having more kids, that will qualify, and that would be a yes. Or it's possible that I might have more kids. Yes. Okay? We're going to deal with Medicare and Medicaid, like we said. So before we get into this, I'm going to give you guys a little quick tour of our website. You'll notice we have a website. It changes periodically. We have our home page, and what you need to look at on our home page and read it is our mission statement and vision. Also links to certain videos for certain of our tests. Okay, play with this. We have our human DNA testing category. Kind of the menu. We have an animal DNA testing category menu. And there's links past these pages. We have our online store for our direct-to-consumer or retail panels. They're divided into animals, endocannabinoid testing, and our retail direct-to-consumer nutrigenomic testing. But what I want you to focus on and learn real well is the Agent Portal. Okay? Our Agent Portal's got many, many cool things here. Your production portal, a way to correct your missing corrections on tests and submit missing documents. You can check your email. There's a company calendar and a company store to order your business cards and marketing materials. Then we have our insurance verification and our testing section. We're going to go through that in just a minute. So, we talked about HMO and PPO. HMO means no, unless it's Humana. We're going to be referring to that as when we go in to verify their Medicare coverage. The way that you're going to verify their Medicare coverage is you're going to go into your Agent Portal and you're going to click the Medicare Coverage Verification button. You're going to enter the patient's zip code. Now, at this time, you should have their Medicare card in front of you and their identification. So whether you use a tablet or a laptop or whatever, while you're doing this, you need to make sure to get an image of the front of the ID card and the front and back of the insurance card. That's going to come in handy here in a bit. But we want to verify after you've asked some questions and get them pre-qualified medically. Now you want to go through the coverage and see if they have coverage for these tests with our program. So you're going to put in their zip code. Now the zip code that you're going to put in here may not be the zip code that they reside in. This zip code is where Medicare thinks that they live. Okay? So if you go through this and it errors out on you, you're going to have to redo it with another zip code. Try that. You'll enter the Medicare number. And where can you find that? You click this link, it'll show you where the Medicare number is. Last name, date of birth. Now notice it's a single digit for the first one. Usually we're used to seeing like 04/28/1986, okay? But this one here, if it's a 4, it's not 04, it'll error out. It's a 4. Same with the effective date for Part A. Now remember I told you we deal with Part B, but we use the effective date for Part A. Once you put that in, you'll hit the Continue button. And you'll typically get this screen here. It'll ask you possibly to enter the county that they live in. So again, you'll choose the county that Medicare thinks they live in. Then they'll pull you up to a second page. Now, in previous trainings, we've said anything that shows up here, if it doesn't say HMO, you're good to go, right? Well, that's true to a point, but what we're seeing lately is that when you click to get to the second page, it may not list anything about their primary coverage. It may say something about long-term care. But you can see here the current plan is a PPO. And if it says something about long-term care or anything else besides a primary type of health insurance coverage, you will actually then click View Plan Details, and it should show you on that page whether or not it's an HMO or a PPO. So then we're going to do these tests. Or after you have the conversation and ask the pre-qualifying questions and verify their coverage, now what we're going to do is we're going to actually enter the pre-qualification information and generate a test request. So the way it's going to work is we're going to gather some patient information. We're going to actually do the application. They're going to then sign a liability release and a consent form. And then we're also part of it is going to be write down the prescriptions. So we're going to go ahead and do one here. What we're going to do is a combo. And what we call a combo is a CGX and a PGX. Okay? We're actually going to do one. When you click the link, it'll take you to a HIPAA compliant server in the portal. And just so we see where that is again, this is the agent portal. You'll scroll down. We're going to do a combo. You have arrows, you have asterisks, and you have yellow fields. Okay? It's a very important caps lock on at this point. Caps lock on. Everything needs to be in capital letters. And it won't let you complete the form until you fill all the required fields out, which is nice. This guy's name is John. Date of birth. See? Makes you do it in 4 digits. It'll correct you. Phone number. Email. Now this has to be filled in. Most people have an email. Make sure you get it if they have one. Okay. And AOL thanks him for his continued patronage. Type in the address. Anywhere in Alabama. Sex. It's not a yes or no question. Administered by. This is where you're going to put your name in here. Oop. Your ID number. Insurance provider. This is going to be Medicare. The insurance number. Primary care provider's name. Okay, so they need to know the name of their primary physician and their contact information. So keep this in mind. Some things have changed. We now are contacting the primary care physician. So if they do not know their primary care provider's name, but they have one, you're going to have to get that information. Somehow they can make a phone call. You're with them or reschedule. And their phone number. The way this works is we're going to contact their primary care physician. We're going to try several times. If they don't return our call, if they don't answer, then we're going to proceed with using one of our doctors. If they do answer, we're going to let them know that we're doing this test. If they say, yeah, I agree, it's a great idea, we proceed. If they say, I don't think it's medically necessary, then we're going to let our doctor decide if he thinks it's medically necessary. It's too important of a test to rely on one guy. Now, what I do is I do not have them sign until the end. So you scroll down. Follow all of the required fields. It's where you'll list any allergies. Whatever they are. Then you're going to ask these questions. You taking any pain medications? You guys can read these to them. You're currently on a pain management system? I will say, yeah, sure. Have you experienced any adverse reactions to pain medications? Maybe, no. Are you on multiple prescriptions for pain management? Sure. Are you on any cardiac medications? Yes. Have you experienced any cardiac chest pain? Why not? You keep going this, okay, and you just keep going, and you just keep going and answer these questions. Can't get past it. Then when we get down here, you're going to list the actual medications. The name of it, and the reason they're taking it. Okay? And then you're going to keep going. At least 2, but keep on going. Another pill, the dosage if you know it. Okay. Another pill. Anxiety. So if you have the dosages, put them in there. If you don't, then just put the reason. The reason you have to put the reason is some of these prescriptions are prescribed off-label usage. For example, Wellbutrin. It's a depression medicine, antidepressant medicine, and it's also used for smoking cessation. So in that case, depression. So now we're done with the PGX part of our combo. CGX. Are you older than 18? Yes. What's the ethnicity? Genetic testing for breast cancer. We're going to put no. Here's the thing. If they put they have had yes prior genetic testing for breast cancer, they will get kicked out of the program. So more than likely. But if we're looking for other cancers, they may not. Medicare is in, but they only want to do one cancer screening, okay? And here's something that's very important. Patient expectations. We'll talk about that at the end here. But the test that you're performing right now is not a test. Okay, kind of a contradiction. The evolution you're going through right now is collecting patient data and submitting specimens. You are not conducting the test, all right? So the doctor is going to call these people after everything's submitted to them, and they're going to say or ask, have you had this test? And then they'll say yes or no. If they say yes, they're out. If they say yes because you didn't, set the expectation correctly and letting them know that you're not performing the test, so when the doctor calls you and says, have you had this test, you need to say no, that's going to be a problem, okay? The doctor will call, have you had this test? The patients will get confused sometimes and say, yes, I've had this test with Joe Smith, okay, just the other day. The doctor doesn't know who Joe Smith is, okay? So, again, when the doctor calls and they say, have you had this test before, the answer needs to be no, or it won't proceed. Also, the doctors that we use are not all white people. They're not all Caucasian. Some of them have accents. Some of them are from the Middle East. Some of them are from India. Some of them are from wherever. But they're all licensed and board-certified physicians. Okay, they'll be calling from a number, maybe an 800 number. It may be another toll-free number. It may be a block call. I don't answer block calls either, or 800 numbers, and neither do most people anymore. But they will leave a message, okay? And so that person then needs to call them back. They're going to try 2 or 3 times. If they can't reach them or get a call back in a timely manner, they're going to go ahead and just reject the test. Okay, so if you were to answer yes to some of these questions, it'll pull up more fields. You have to answer them. Has a patient any other type of cancer? We're going to say that no. And going back to the email here, I'm jumping around a little bit. If they don't have an email address, then you'll put no email. Okay? Going back down, scrolling. We've got the medicines. Here's the cancer. Okay, they give you an example here. We don't need the person's name for the family history, but we do need the relationship. Okay? Uncle. Oop, I do it still. Uncle. What side of the family is he on? Paternal uncle. Okay. We don't need to know that. Unknown, whatever. And how old was the person when they were diagnosed? Again, it doesn't have to be exact, but it needs to be close. There's a difference if you put 65 years old here and 18. So get this information from them. And we're going to say aunt. Even if it's a gender opposite, we're still going to write it down. Brother. Okay. Prostate. Sister. Both. breast. So knowing what we know, do we have 3 people that are qualifying in the family? Well, we have the uncle, he had breast cancer, that's one. We have the aunt that had ovarian, well, we can use that. We have 2 more that are non-environmental and non-gender opposite only. If you know, you can put it in here. All right. This cancer symptoms, this is for personal history. So if you're doing a family history application, you don't need to worry about these. But a personal, if he said he had prostate cancer, then you would answer these questions. You'd say, hey, have you had any of these? Jaundice, abdominal pain, nausea, fatigue, or anemia? You don't have to ask them one at a time. You can just ask them in groups. And then scrolling down, this is the release and consent, the consent forms. All right. So it's at this point in time where you've taken a picture of the ID card and the insurance card, front and back. And this is where you're going to go ahead and upload them. Okay. So you put them in there. Go ahead and grab a couple here. Put something in here real quick. Okay. It's for the insurance card, front and back. Patient ID. You can't proceed without these files here. Additional photos if needed. Okay. Or additional documents. Then what I'm going to do is I'm going to scroll back up, and I'm going to have them sign the consent forms. So they're able to then read these if they want. Okay? It's their job to read them. And they'll sign an initial. So the way I usually do this is just so we're clear, Mr. Smith, we have permission to run this test like we talked about, right? So you'll click here to sign. This is where the patient will then take your mouse or your mouse pad or your tablet pad, and they will actually sign their name with your device, and it has to kind of be legible. So they'll sign it, Joe Smith. And you'll type it in. And you'll hit apply. Then you go through these, and you'll have them initial one time. And apply. You can read these to them if you want to, but it's their job to read what they're signing or initialing to. So you can say, hey, listen, so like we said, do we have your permission to do what we talked about? Yes. So you understand that, you're going to release this from liability and consent to this test? Yes. If they want to read it, let them read it. You do not need to read them to them, but one you do need to go over is this one here. I understand the following information regarding use of specimens for research. So there's already automatically pre-checked. I agree to use my de-identified biospecimen for research to improve genetic testing for all patients and contribute to scientific research. It's defaulted yes, but you need to go over this with them because some people don't want their de-identified data, if you recall from HIPAA, released in any way, shape, or form. So if they're into it, just click it. Click them all. Then here's the pharmacogenomic testing consent. This is the combo, remember? Okay. Now from this point, we should be good to go, but for some reason it's not letting us complete the application. So we're going to go ahead and see what we missed. There we go. Well, we missed a couple questions. The release. Now it says click to sign. This is very important. Write this down. It says here, please enter your email and then click to sign this document. Your email refers to this email right here, order_status at advantagemedicaltesting.com. If you put your personal email in here, it's a common mistake. You'll have to get that to this email address that's in the screen here after the test. This is not where you put the patient's email in. This is where you put order_status at advantagemedicaltesting.com. That sends a copy of this application to another HIPAA-compliant storage server in which when you guys have mistakes out there and need to make corrections or something happens when you transmit it, we can then go ahead and retrieve this document to help you fix these errors so you can get paid for these tests. So then you'll hit click to sign. Now once you do this, it'll say thank you. You can download a copy if you wish. Okay? You can download a copy to your computer for 7 days and hold it. If for some reason you're in the portal, the production portal, and you don't see this show up, you should know that before 7 days appears. So download one if you wish. Okay, so that's that. That's how you do a combo. Cardio. Again, you'll follow all of the required fields and fill them in. Just keep going down. Additional information or notes. Again, front of the ID, front and back of the insurance card. Very simple, short application. Alzheimer's, Parkinson's, and dementia. Okay, again. Additional information. Family history. This is the one where you need the names and the age that they were diagnosed with. Front of the ID card, front and back of the insurance card. Beacon Carrier test. Should look similar. Consent. Then some questions. Here's the question that has to be yes. If the patient is not currently pregnant, is the patient currently trying or planning to become pregnant in the future? That has to be a yes. ID card, front and back of the insurance card. Now that you've done these and submitted them with the order_status at AdvantageMedicalTesting.com email, now it's time to go ahead and swab them. So let's go ahead and do that. A little short video here. I'm going to make a couple changes. We use the OraCollect swab. It's going to show you how to open it. Most important thing here is to tell them ahead of time, 30 minutes prior to the test, don't eat, drink, or smoke anything. You can open the package. It's a good time right here to have gloves on, right? Hand them the collecting device. they're going to swab themselves. Each side of their mouth, it says 10 times, but it should be 10 seconds between the cheek and gum, rotating the swab. You want to get as many cheek cells as we can, both sides, left and right. So if you're doing 4 tests, that's 4 swabs, 4 times they have to do this. I make a joke about it and say, hit it or 2 at once, double fist it. And so some of them get it. So you're going to go ahead and hold it upright after you have them swab with your gloves on, and you're going to unscrew the cap. You're going to put the applicator back into the tube and screw the cap back on tight. Not like dad tight, but, tight so it's not going to leak. Then you're going to shake the tube like 15 seconds. There's a fluid in the tube. The fluid is actually drying the DNA. Then when you're done collecting the sample, you're going to label the swab. And you're going to label it with their first initial, dot, last name, and their date of birth. You're also going to initial the same way and label a bag. You'll sometimes get these bags in with your swab shipments. Sometimes you won't. And you're then going to label the bag the same way. It's 1 swab per bag. So if you do a combo, which is a PGX and a CGX, that's 2 swabs. That's not 1 swab. And that's 2 bags, not 1 bag. First initial, dot, last name, date of birth on the bag and the tube. So here's how you package them. Here's what you do with them. So the collected swabs should be sent to QC as soon as possible. You're provided with prepaid shipping labels. No more than 1 package per day per agent. However, if you've got an appointment today and you swab these people, and then you have an appointment tomorrow to do some more, it's okay to hold on to these swabs for 2 or 3 days and send them all in 1 box. But if you do one today, 1 swab, and you don't have any appointments for the rest of the week, or you're not going to work for the rest of the week, then you need to ship that thing tomorrow at the latest. Label them properly. First initial, last name, date of birth. Then it says here, fill out a swab packing slip, which will show you how to do. You'll print a hard copy on your printer, and you'll stuff that hard copy into the swab box. You'll also then save that same form before you leave the screen and save it as a PDF, because you're going to need to upload a PDF with your production report. Once you've done all that, you seal the box, take that label, and the first time you do it, just take the whole label and take it into the UPS store with you, and they will show you how to apply the label to the box. It's within the package of paperwork that comes with you. The swab packing slip. I'll just show you where this is located. It's right in the agent portal. You click the download button. You put your name, your ID, the ship date, and the tracking number. The tracking number is located on the prepaid labels that we've given you. The total number of swabs. So John Smith did a PGX. His date of birth. And what was it? It was a PGX. You'll do this again, and you'll put in that it was a CGX. Okay? What you'll do then is, like I said, you'll print it as a hard copy when you fill it all out, and then you'll print it or save it as a PDF because you're going to need that later. The next thing that happens is a production report. And again, funny enough, it happens to be right in your portal. Production reports. Okay, great. Here it is. So here we go. The date that you're going to be shipping. Your name. Your ID number. Patient's first name, John Smith. And what you'll put on here is, this is where you don't have to put the individual tests. You can go combo, PGX, CGX, or it's not updated yet, you go cardio. Okay, if that's what it was. He is actually a combo. Then you did Samantha Smith. All she did was a PGX. And this will continue to grow as far as you need it. Then you're going to upload the file, the packing slip, that PDF that you saved, and then hit submit. Okay? Let's go over the processes here. The flow of the swab, so to speak. Here's what happens. You're out there in the field. You're submitting these tests electronically. If you have a problem with your internet connection or you have any other issues, then we're going to talk about that in just a second, how to fix that. But for now, here's how it works. You do the test, you submit it properly, you put order underscore status in the email section to complete the form like it asks you to. You collect the specimen out in the field. Then you're going to send the swabs into QC, like we discussed. QC, when they receive the specimens, they process the test applications when you transmit them, but then once the swabs arrive in the mail, they're going to store them in a vault. They're going to handle all that. They're going to get all the doctor and the lab. And then once the doctor approves the test, once the insurance coverage has been verified, then they're going to send those samples to the lab. Okay? Now, the lab releases payment to us on the ship date that is present on your agent portal, the production portal, the ship date. The ship date is once the doctor approves the test and the samples get shipped out on that date, that's the approval date. That's when it's released for payroll purposes. So everything that has a ship date prior to the 15th of the month gets paid, and payroll gets initiated on the 30th. Everything that's processed and approved, shipped between the 15th and the 30th then gets paid on the 15th of the following. We pay out on the 15th and the 30th is when payroll is initiated. Depending on your bank and the wire time frames, you may not see your money till the 1st or the 2nd on the 3rd when we do a 30th. The 15th, you may not see it until the 16th or the 17th. You pay in the form of an e-wallet, which you signed up for in your onboarding. We ship the money out as soon as we get it received. If the weekend, you guys can tell that if the payday falls on a weekend, sometimes you don't get paid till the Monday. Okay, so we initiate payroll bi-monthly. Here's the cycles. Estimated turnaround time, 7 to 10 business days, approximately. If the doctors want to pull files, ask questions, can't reach the patient, you didn't list things correctly, then this time frame is out the window. If you forget to put a cancer history in where you're doing a CGX test and they don't have any personal history of cancer and they have a family history but you didn't put it in there, guess what? This time's out the window. If you submit the application and don't put your name on it and agent ID number and you screw up phone numbers or birthdays or misspelling a bunch of stuff, 7 to 10 days is out the window. Okay. So we're going to go ahead and get back into the website again. And so from here, so you can track your tests, we're going to go into the agent portal. This is the production portal. And from here, you can put in and track stats, sample collection. If you want to see what you've done from the beginning of time, the best way to do it is this. Hit export report. Okay? And it'll bring it into a spreadsheet. Okay? And then from here, you can filter by entry date. Would be a good one to start. And this will list everything that they've received, okay, from you electronically. It takes about 5 to 6 days sometimes to go ahead and enter all of the information required for the spreadsheet, but if you search by the entry date, that's kind of a real-time thing. So if you submit something today, that should be showing up today in the portal or tomorrow at the latest. It just won't be all the information you want to see. So go into the production portal training video for further information on that. Corrections and missing documents. If you go into your portal and you find out you have stuff that's screwed up, you click this button and you fill this form out accordingly. Amplifying notes, updated photos. Now this form at this time can only accept JPEG images. We're working on that. So you can go into, like for example, if your internet timed out, or if you didn't get a signature, it's not legible, might be one of the notes, you can go have them sign the release and the consent form, and you can then submit those here with ink signatures. But before you do that, you're going to have to, as it stands now, convert those documents into a JPEG. And the way you're going to do that is by going to this website here, smallpdf.com. And this will allow you then to convert a PDF to a JPEG. Or you can take a picture of the inked signature on the release and consent forms and then just upload that JPEG to the correction link without converting. So what am I talking about on these release forms? Well, we're going to go into another part of our portal. We're going to go to downloads. TeamViewer download, you should be doing that during your onboarding process. So lets us help take control of your computer if you're out in the field. Slack, you can join that. That's so you can be involved in the unofficial communication for AMT and Teams. But we're using that more and more. There's marketing material in here. Just go through it at your leisure. All right. So when you get an error in your production portal, it says signature illegible. That means this. For every test, other than the cancer, you're going to need to have them sign this form and date it. For the cancer test, you're going to have them sign this form. It's 2 pages, and there's initials required on this one. Save it as a JPEG, save it as a PDF, convert it as a JPEG, don't matter, whatever you got to do to make it happen. Then we have the release form. This is for all tests. Okay? All tests have to have this form signed. So if you do a combo, you're going to need this form, and this form. If you're going to do a PGX or a cardio or APD only, you're going to use this form and this form. Cancer only, this form, and this form. Okay, the picture, here we go, good. All right, also on the website, agent training links. Okay, you've got the video from today will be here. You've got production portal training. You've got an intro to nutrigenomics, which is our retail panels. You've got retail panel training here.
Said I left the conference.
Okay.
Why did it say I left the conference? Because you took your...
Please mute your phone. And we've got some more videos for you. We've got some audio recordings for sales training. All kinds of stuff here. All right. So that is our basic training. Your managers and the corporate office will work with you to go ahead and continue your training. But for now, I'm going to go ahead and stop the recording.